Where are we at? I touched on this before with these maternity services. We heard, obviously, $10 million from the Health Minister as being more the figure that we're looking at instead of 35 to boost maternity services at Royal Darwin Hospital. Is there another meeting coming up, or where's this at from your perspective?
Yes, look, we've been in active discussions with the Commonwealth Health Department since the maternity forum that occurred in Darwin a couple of weeks back. And we've progressed that along. It's been made quite clear to us that the Commonwealth is more supportive of the more moderate number, or in the $10 million vicinity. Mm-hmm. And we've just in recent days provided a whole bunch of detailed information between senior officials about how that will be deployed within Royal Darwin. So we don't actually have our hands on the cheque yet, Katie, but
yep.
We've given the Commonwealth the sort of the details of how that will be used within the hospital, and we're optimistic that we'll be able to get our hands on the funding very soon.
I know you're pressed for time, as am I, but what is that $10 million going to deliver?
Look, it will deliver a range of refurbishments to the environment where you come to have your baby at the hospital. I've mentioned RDH is old and it's a bit run down, and it's perhaps not as aesthetic and pleasing an environment as a private hospital experience, and we certainly can't compete with the private sector. But had we been able to secure the $35 million, we could have done some internal building works and co-located all maternity services in one spot. We won't be able to do that for 10, but we will be able to do some really, really nice refurbishment. So for mums and families who come to Royal Darwin to have their baby, it'll be a much more pleasant experience and a nicer environment than it is today.
$1 million also put into the maternity services, which ensure an upgrade within the NT Health Darwin Hospital for maternity services. But
do you reckon we still need more, though? Do you reckon we still need more? I mean, that's what the AMA is saying.
Well, yeah, obviously, I'll always advocate for more money, and that was part of the reason why I went to Canberra. And it's something that I would encourage the Health Minister Steve Edgington to actually go down to Canberra, get in the face of the minister, sit in front of him, and just map out exactly what funding you need to draw it up. Because the concern I had, and I'm not trying to throw stones here. We're trying to work together to get a good outcome for Territorians. But with the maternity services, for example, they were just asking for like $34 million, but there's no really business case or a breakdown of costings or funding of that. And that's you need to actually break down, and so to ensure that the money's well spent. And if Steve Edgington thinks that that's a good case, well, he should be flying down to Canberra and physically putting his face in front of the minister and just going, look, we really need this money, and this is why, X, Y, and Z, this is why we need it. Because
I know you said, that you are working together, but do you reckon that everybody is? I mean, given the tit for tat that's been going on between the Northern Territory government and Luke Gosling, and I know you're not Luke Gosling, but do you reckon we are actually all working together here?
Well, it's the responsibility of Steve Edgington to go down. He is the Health Minister for the Northern Territory. He has oversight of all the hospitals and the healthcare in the Northern Territory. Now, I know Luke and Marion are advocating in their roles down in Canberra, but Steve has a whole department behind him. He can break down those business cases for maternity services, and it is really important to have a really good, strong relationship with those federal ministers.
Chief Minister, still in the health space, we know that Minister Steve Edgington revealed on the show last week that we're expecting to get $10 million to boost maternity services, not the $35 million which had been requested. Now, Labor's Luke Gosling maintained in a statement on Friday that we didn't provide the same level of detail in the proposal as other states. Has this been fumbled by the department, or what's the go?
I had a briefing on this, Katie, last week, and I can categorically tell you we provided all of that information to the Federal Minister. He has had it for months and months and months. And again, we just have a Labor federal government that's just not taking the Territory seriously. And we see time and time again these examples of where, Canberra just completely ignore us. We've got the fact that every other capital city has had an increase to the cap on the housing price when it comes to using the new grants and the new low percent wages, interest rates. Yep. And here we are in Darwin still copping a $600,000 cap to no avail. We've got a $400 million lack of underspend by the federal government in our health system. I mean, it just continues on and on and on. And so, again, the member for Solomon, that's his job, is to have throw pot shots at me. Good for him. But at the end of the day, this federal government needs to stop ignoring the Territory. We do exist. We are an important part of this nation. And in fact, we have everything this nation needs to be strong and successful. They better start paying attention and stop the petty politics.
So can I just be clear, though? This money, this $10 million that we're expecting, it's for maternity services at Royal Darwin Hospital, and you are still pushing for private services. Is that correct?
Yes, correct. Yeah, absolutely. So the $10 million will be for upgrades at Royal Darwin to make sure that we've got the facilities that women and families deserve.
It's not going to go far enough, though, is it? Like $10 million. And I said this last week, I don't want to sound ungrateful, but honestly, $10 million to upgrade our maternity services at Royal Darwin Hospital is barely going to touch the sides, I would think.
Yeah, it may be a lick of paint and a few other bits and bobs, Katie, which is why we asked for 35. But obviously that has not been forthcoming, and they're throwing us the chicken scraps with the 10, which again we have to pretend to be so unbelievably grateful for when they still owe us $400 million this year, Katie. So this is the stupid game we're playing with the federal Labor government, but we'll continue to push for Territory interests first. But it will be that, and then separate to that is obviously the whatever's going to happen with Healthscope and any new purchaser going forward. We have been explicitly clear in every meeting and every forum that there must be a return to maternity services with a new purchaser or provider of that service. We are looking at how we can enforce that in our licence terms, and we are very clear that there must be private maternity here in the Territory.
All right, Chief Minister, the text line's going off. Someone's just texted through and said, come on, Chief Minister, go and sit in ED, no security, no nothing, and observe what high-risk garbage nurses, doctors and healthcare workers have to put themselves in. They too are first responders, says that message.
Yes, but that's not what we're talking about, listener. So thank you for that, but this is incorrect. What we're talking about is all of the ancillary services in the health space. So it's not nurses, it's not doctors. As Katie read out at the start, it's admin workers, cleaners and other people, all who have an amazing role to play and an amazing job to do. But at the end of the day, our police are out there keeping us safe, and that's everyone's top priority, and there's no bottomless money pit here.
All right. Now, I have just had word as well that Code Yellow is still in place, but things are still high demand, but hopefully getting a bit better. So we'll no doubt keep our listeners up to date as we get some further info. Now, Dr. Zorbas, that breaking news that just came through from the Health Minister, he's anticipating it's going to be $10 million additional provided by the federal government for maternity services here in the Northern Territory, not the $35 million which had been requested. What do you make of that?
Yeah, look, the Minister said he was extremely disappointed. I'm angry, and the potential mothers of Darwin should be ropeable. You mentioned that we don't want to be ungrateful, and $10 million is $10 million, but ultimately when it comes to fixing health facilities, $10 million doesn't go very far. It won't fix our capacity issues. It won't be enough. It won't be what we need. This is a recurring problem in healthcare in Australia. Our funding systems aren't very good at pointing the fire hose of money where the problems are. So if you take heart disease, we've got the highest rates of heart disease in the country, and yet we're the only capital city in Australia that doesn't have a full-time cardiothoracic surgical service for bypass surgery, and people are constantly having to be flown out of the Territory for that. We're not really, we can look at how they work it out and per capita, and the feds and the states and territories can argue with each other, but at the end of the day, the money needs to go to where the sickness and the people who need the resources are.
Yeah, I couldn't agree with you more, and it's something you and I have spoken about before. But yeah, I think you're right. I think the women of the Northern Territory, the future mums, people planning to have families, $10 million, when you think about that and think about what it's actually going to do, I don't think it's going to be much.
It won't be enough. Even if it does increase any sort of the clinical spaces that we've got, it won't be enough. Part of that is because our facilities are getting older, so Royal Darwin it's an age facility now, and we do need a new hospital, and that is on the horizon, but that's not something you get done overnight. So the refurbishment work you need in a building like Royal Darwin Hospital costs a lot more than on a new build or a greenfield site.
So I'll be travelling down to Sydney with my toddler on Monday on the red-eye. So we have to go down prior to the start of the 37th week to be able to make sort of the 4-hour flight cut-off. So we'll be heading down there. I'll be staying down there with my parents, who have wonderfully decided to put us up, and my husband as well when he makes it down. And I'll be giving birth at some point around the 7th of September.
And why did you make the decision to fly down south to give birth, Danielle?
We made the call because we were going private up here with my obstetrician who helped us with the birth of our last child. There were a lot of complications during the birth. I ended up in surgery, lost a lot of blood, and there's a higher risk chance of that happening again with the next one. So we were very keen to go private. When the private was announced that it was closing, it became obvious that there was no help being requested from the federal government like it was with the Hobart closure. We decided that it would be the safest thing to do to head down to Sydney, where we had the support and we could then access those private services.
How did you feel hearing that news that private service was winding up? You've had a complicated birth previously. You had a plan to try and get through the second one okay, and then you get this news. How did that feel?
Oh, it was gutting. It's really hard to describe. We're losing the obstetrician we trust, who delivered our last baby and who's been with me the whole process for this one. So we're losing her, but with her blessing to go down, because it will be safer for us. But it was really horrible, because all of those things that we really relied on, especially after the birth, so all that continuity of care for 5 days of people checking on us, making sure that bleeding was under control. I had iron infusions because my iron was super low from the blood loss, and just helping us 24/7 help with our newborn, and my husband being able to be there and help as well. All of that stuff was just not going to be available to us. So it was really hard.
You've got a toddler, you live here in Darwin. What does it mean practically to have to fly to Sydney, just juggling everything and the costs as well?
Yeah, the logistics has been really interesting. So it was more than $6,000 in flights alone for myself, my husband and my toddler to get down and back. That $150 of that gets covered by health insurance. So not a great deal. And then we were just really super lucky to have my parents down there. They're remodelling 2 of their 3 bedrooms in their house to make sure that they fit us all in. They're providing a transport. So if we had to pay for accommodation and transport, it would just be completely just not doable. But because we have that support, we do have the option of doing that. But then it's the ancillary stuff, making sure that our dogs up here are looked after, the house is looked after. It's a lot. Plus, organising the actual, speaking to the new obstetrician who's going to be taking over, and getting all of that sorted, and doing, hospital tours remotely via FaceTime.
You've been speaking with other mums and health professionals about how things are going with RDH's maternity services and that extra pressure. What are you hearing?
I'm hearing a lot from other mums, particularly. It's really hard for the guys who are working on the ground to be talking, but we know that they're really busy, and they are swamped, and some are pulling double shifts. But from the other mums, just the stories that are coming out. I'm sure you'd be aware of Tessa, who I speak to a lot. We're friends, and she was waiting in the waiting room for 3 hours in active labour, just trying to come up with a quiet space because people were coming and going, making coffees, and she ended up walking empty hallways while in active labour, waiting for a birthing room because none were available. There was just no capacity for her. And then we've been hearing from other mums who have been having inductions delayed, which causes them extra stress. That sort of thing can be really scary for mums. They've got this extra anxiety going on, and we're being told a lot that everything's okay and that the capacity's fine and that the hospital can manage, but then we're hearing from people who are coming out of it saying, I had the worst experience because of that capacity, and the best experience because of the midwives and the doctors that are, looking after them really, really well, but then the facility is letting them down.
The states and territories. Mm-hmm. I can't rule out that any state and territory may wish to put another issue on the table at some point in time, which they wish to negotiate, whether they want to negotiate that as part of a kind of multilateral agreement or whether they wish to deal directly with the Commonwealth. I just can't rule out that someone wouldn't make those representations.
Okay. So I suppose with the Northern Territory recording the nation's highest rates of stillbirth, congenital syphilis, rheumatic heart disease and preterm birth, what is being done, I suppose, at a federal level to adapt maternity models to these particular complex needs?
So Celia Street, Acting Deputy Secretary, Strategy and First Nations Group. There's a number of elements to your question there. So I think what I would say in terms of the models of care, we do provide support for birthing on country. As you're aware, we have a number of different models that we support that go to First Nations more broadly. In terms of model of care, specifically, say in the NT, we haven't got a piece of specific work on that at this point in time.
Okay, I suppose with the proposed closure of the private maternity services, this will impact particularly across those areas. Has there been any consideration given to this impact going forward?
Yes, so we have been in conversations with the Northern Territory Government in terms of the impact of the closure of the Healthscope hospital, and unfortunately I don't have everyone here with me because that's under outcome to the private side of things. But we have been in conversations with the Northern Territory Government about supports that they may seek from government, but there hasn't been any outcomes from that at this stage.
Okay. So why did the government not intervene to sustain the private maternity services in Darwin when studies showed they were more cost effective and, I suppose, safer for patients?
So can I get you to repeat the question, because I don't think that we have something there in terms of the safety.
So, I suppose health is everybody's responsibility at a state, territory, federal level. I suppose I'm wanting to understand why the federal government has not intervened to sustain the private maternity services.
I think and maybe
Senator, Professor Alice McMillan, Chief Nursing and Midwifery Officer. Senator, can I confirm, in referring to private maternity services providing particular outcomes, are you referring to the recent published study by Callender et al. that provided a perspective or a view that, in fact, private maternity did provide better outcomes than those of the public sector? Is that the basis of your questioning? Because it would be fair to say that there's been significant response in relation to that publication, and there is significant evidence that is contrary to that in relation to that study and the belief that that study didn't appropriately adjust for a range of variables before it was published.
Well, no, I suppose my concerns are more to do with well, there was a report. There's a number of reports that I am referring to, which I can have emailed, but specifically we have, which is evidence, the highest rates of stillbirth, congenital syphilis, rheumatic heart disease and preterm birth, as well as the fact that this will now apply pressure to the system given the proposed closure of the private maternity services. And I suppose with that in mind, I'm trying to understand why the federal government hasn't intervened.
So I can perhaps... Ross?
Senator Ross Hawkins, First Assistant Secretary, House and Strategy Division. As Ms Street said, typically comes up under Outcome 2, so we've got our private hospital expert coming this afternoon, but I'll try and answer as much of your question as you can. So, very conscious that the facility they're referring to in Darwin is run by Healthscope. It's a private company, and it's their decision as to how and which and the services are provided within that private hospital. I haven't got the exact date here when they kind of spoke and told us that that was closing, but there's a level of engagement they had with the Northern Territory government, and then a level of conversation, I think it was kind of over a 3 or 4 month period, around what the transfer of those services back into the public would look like and what needs to be done between. And this includes elements of the workforce and the support mechanisms that would typically be in place as they close down their services, and that would be relocated into the public. And I think that's where kind of Ms Street was saying, and these are kind of further kind of conversations as part of kind of future hospital agreements around what the jurisdictions would want to do as part of that. But the closure of the private hospital was a decision for Healthscope that they made at that time.
So, well then, what then, if any, modelling has been conducted as to the knock-on effects of the closure, including paediatric services, litigation risks, and insurance costs, as clinicians have learned?
Senator, we'd probably need to take that on notice, largely because it would be an issue for the Northern Territory Government. So the Northern Territory Government provides the maternity services for the population up there, and they would have looked at what the impact of that would have been with the private work coming back in. So we can take on notice and engage with them on what that, if they've done any modelling, what that might look like.
I'd appreciate that. And how is the federal government addressing the fact that Northern Territory families are now being forced to travel interstate for their private maternity care, and often for a period of up to 12 weeks?
Yes, Senator, as I understand, and again, our expert is here this afternoon, I think there is still going to be levels of private offering within the public hospital, and that's been an issue that the government have been discussing with health insurers. But again, we might be able to provide a bit more detail on that for you later on this evening.
Yeah, I would appreciate that. While it's claimed that numbers fell from 700 births a year to fewer than 300 in the private system, does the department accept that this oversimplifies the issue, given the overwhelming complexity and national worst numbers for maternity outcomes, as I've previously mentioned, in the NT public system, that they have to negotiate?
Senator, there might be one for the kind of Chief Nursing Midwifery Officer to answer, because when you do get to certain levels of birth, and certainly we've seen this in the private system, we find that private operators feel that it's no longer safe to offer a service, largely to keep the necessary staff with the expertise on hand. So that's where we've seen some closures across the country of maternity services historically, because the number of private births has dropped off. But it is an important factor that leads to the kind of delivery or effective delivery of a safe and efficient service. I'm not sure if...
So, yes, Senator, there is obviously a point at which very low numbers of obstetricians in this situation, or paediatricians, you may not be able to sustain a service going forward. What I do understand that has been put in place is that the Northern Territory Government has put in an interim arrangement with a midwifery-led model of care to support local communities with their birthing, so that where possible it can be supported within the public system, and that can be done supported by the public health system in the Northern Territory. So there has been changes made so that the use of private midwives can be sustained in the interim, while further consideration to service provision is made by the Northern Territory Government.